Chapter 6. Autonomy. Today, we examine one of the most central concepts in bioethics, autonomy. Autonomy is the principle that upholds the right of individuals to make informed, voluntary decisions about their own healthcare. It is more than just a legal or procedural requirement. It is a moral commitment to respecting persons as dignified, capable agents in their own lives. This chapter explores the nature of autonomy, its application in healthcare, its relationship to informed consent, the challenges it faces in mental health treatment, and the ethical tensions that arise when autonomy conflicts with beneficence or public health obligations. 1. The meaning of autonomy. The word autonomy comes from the Greek autos, self, and nomos, law, literally meaning self-rule. In healthcare ethics, autonomy refers to the capacity and right of a person to make their own decisions about medical care based on their values, beliefs, and preferences, free from coercion, manipulation, or undue influence. The ethical commitment to autonomy flows from the principle of respect for persons. Every individual has inherent worth and dignity, and part of respecting that dignity means acknowledging their right to choose, even when those choices differ from what others might decide in their place. 2. Respect for persons. Respect for persons requires recognizing that each patient is more than a body to be treated. They are a thinking, feeling, valuing human being. This principle demands that individuals are given full information about their health status and treatment options. They have the freedom to accept or decline treatment. Their decisions are honored, even if others believe those decisions are unwise. This is not always easy for healthcare providers, especially when a patient's decision appears to jeopardize their health. Yet, in ethical medicine, the patient's right to decide remains central. 3. Informed consent as the cornerstone of autonomy. One of the most visible and practical applications of autonomy in healthcare is informed consent. For consent to be truly informed, 3 conditions must be met. Disclosure. The healthcare provider must give the patient comprehensive, understandable information about the diagnosis and nature of the condition, proposed treatments and alternatives, potential risks and benefits of each option. Understanding. The patient must comprehend the information given. This may require avoiding jargon, using interpreters, or employing visual aids for those with limited health literacy. Voluntariness. The patient must be free from coercion, manipulation, or undue pressure. Their decision must be made willingly. Capacity. The patient must be capable of making the decision, which means understanding the information, appreciating the consequences, and communicating a choice. When all of these are present, the patient's decision is an exercise of autonomy in its truest sense. 4. Capacity and autonomy. Capacity is not the same as intelligence or education. It is the ability to process relevant information and make a decision that aligns with one's values. Some patients may have temporary or permanent impairments in capacity due to illness, injury, or developmental conditions. In such cases, decisions may fall to surrogate decision makers, family members, legal guardians, or appointed healthcare proxies, who should aim to make decisions consistent with the patient's known values and best interests. 5. Autonomy in mental health care. Mental health care presents some of the most difficult challenges to autonomy. In certain cases, patients may be involuntarily hospitalized or treated without consent if they pose a danger to themselves or others. This raises pressing ethical questions. How do we balance the patient's right to self-determination with our duty to protect them? When does intervention become coercion? How can we minimize the infringement on autonomy while still ensuring safety? The text discusses case studies involving involuntary psychiatric holds, showing the complexity of these situations. Psychiatric nurses and other mental health professionals must strive to involve patients in decision-making as much as possible, even in involuntary care. Advocate for patient rights. Maintain dignity and respect throughout treatment. 6. Coercion and voluntariness. Coercion occurs when someone is forced or threatened into making a choice. Even subtle pressures, like implying treatment will be withheld unless a patient agrees to a certain procedure, can undermine autonomy. Voluntariness means the decision is made freely, without manipulation. This is why informed consent must be more than a form to sign. It is a process of open, honest, respectful communication. 7. Autonomy versus beneficence. In many ethical dilemmas, autonomy comes into tension with beneficence, the duty to act in the patient's best interest. For example, a diabetic patient refuses insulin due to personal beliefs in natural healing. A cancer patient declines chemotherapy, preferring quality of life over prolonged treatment. In such situations, providers may feel compelled to act for the patient's good, but overriding their decision can undermine autonomy. The ethical challenge is to educate, inform, and support, but not to impose one's will. 8. Autonomy in public health. Public health emergencies can place limits on individual autonomy for the sake of the community's safety. Quarantine orders, mandatory vaccinations, and restrictions on movement are examples. The ethical question becomes, when is it justified to limit autonomy for the common good? The principle here is proportionality. Restrictions must be necessary, effective, and the least restrictive means possible. 9. The role of cultural context. Cultural values shape how autonomy is understood and expressed. In more individualistic cultures, autonomy is framed in personal rights and self-determination. In more collectivist cultures, decisions may be made in consultation with family or community leaders. Healthcare providers must navigate these cultural dynamics sensitively, respecting autonomy while honoring cultural traditions that value communal decision-making. 10. Autonomy in end-of-life care. End-of-life decisions, such as do not resuscitate, DNR, orders, withdrawal of life support, and physician-assisted dying, are deeply rooted in autonomy. Patients have the right to refuse life-prolonging interventions if they do not align with their values and goals. For providers, this requires honest, compassionate communication, respecting advanced directives, supporting families while upholding patient wishes. 11. Safeguarding autonomy in practice. Healthcare professionals can safeguard autonomy by encouraging patient participation in decision-making, using clear, plain language when explaining medical information, checking for understanding, not just assuming it, recognizing and avoiding undue influence from family, peers, or providers, documenting discussions and decisions thoroughly. 12. Reflection and ethical growth. Respecting autonomy is not just a procedural checklist, it's a professional commitment. It demands humility, empathy, patience, and a willingness to stand by a patient's choice even when it challenges our own convictions. As we move forward, remember, autonomy affirms dignity. Informed consent is the heartbeat of ethical care. Protecting autonomy is protecting the humanity of our patients. Closing thought. In the words of the President's Commission for the Study of Ethical Problems in Medicine, respect for autonomy is not simply a matter of acknowledging a patient's decision. It is about creating the conditions in which individuals can make their own choices and act on them. Ginstein ting implement